So, firstly, thank you so much for being part of Healthcare Product Summit 2020, sir. So, I just wanted to ask, how was your association experience so far in the summit?
Well, this is my first time at the Healthcare Product Summit, and I think it's been run very well. Interesting partners are there. I loved some of the sessions that happened from the startups. What was interesting was a lot of them were talking about artificial intelligence, and typically in the technology side of the industry, I have not seen a lot of product-based startups come out of India, more services-based companies. But what is interesting in the healthcare summit like this is the number of product-based companies that are coming there. So that definitely was interesting for me.
Right, sir. One more question, sir. The theme of this conference is Let's Rethink Healthcare. If you have seen the band, we have come with the
I
same
did,
thing.
yes.
Yeah, let's rethink health and care. So, what is your association with this theme, sir, or your company's association? I'm okay with your personal or professional answer in this. What is your association with rethink health and care? Do you think it's a time to pause and rethink, or what is it?
Healthcare industry is not at a maturity level right now for us to even imagine about taking a pause and rethinking about healthcare. If you look at healthcare industry today, it's an evolutionary stage. It is where technology was about 25 years ago. Corporatization of healthcare is only happening now. Government's involvement in healthcare is only happening now. India spends less than 3% of its GDP in overall healthcare, including education and delivery of healthcare. Most tier 1 countries, developed countries, spend close to 6% of their GDP. Countries like Bangladesh and Sri Lanka spend 4% of their GDP in healthcare. India spends 3%. So I think talking about taking a pause and rethinking healthcare is too early at this point of time.
Okay. So, what about the patient education aspect, sir? Do you think the healthcare leaders today should focus more upon having the preventive aspects rather than having the secure aspects?
So you're talking about clinical management of healthcare and preventive management of healthcare. The shift that is happening today is, if you look at the government of India has mandated NABH as an accreditation body, and by the year 2024, 100% of the hospitals providing healthcare services in the country need to be aligned to NABH standards. Patient education is a crucial part of NABH certification and accreditation. Large hospitals today are JCI accredited, and even as part of JCI accreditation, patient education is a crucial component of healthcare service delivery. So patient education is happening. Of course, with the advent of YouTube and other social channels, the opportunity for patients to educate themselves, not only in English but in Telugu, Tamil, Hindi, any language you choose, is available out there. Question is, how many patients are taking the responsibility of their lives on themselves? Today, if you visit a doctor, you expect the doctor to solve all your problems. But keep in mind, the doctor, the healthcare provider, the institution is only one part of healthcare management. The biggest part of healthcare management is me, the individual. So that's where the role of patient education comes in.
Great, sir. That's a great input. Final question, sir. Give us some insights about your products or your company, sir.
Medvarsity is Asia's largest online medical education company. We've trained over 50,000 doctors so far, with over 7,000 doctors coming online every year to upskill and reskill themselves across 140 plus courses. Our goal is to impact healthcare in India through education. And of course, India is just part of our phase 1 goal. Over the next few years, we're going to be the largest healthcare education company in the world.
Wow, that's interesting, sir. Well, anyways, thank you so much for being here, sir, and it's a pleasure having you here.
Likewise, thank you so
Yes.
much.